Hi, I'm Ken Cutbush. I'm an orthopaedic shoulder surgeon working in Brisbane. I'd like to share an interesting case with you, a patient that I saw this week. He's a professional athlete and he's got an anterior labral tear. He's had a previous shoulder surgery to tighten the shoulder up and repair the labrum, and he's subsequently had a dislocation, significant traumatic dislocation, and has redislocated and re-injured his shoulder. We're going to look at his scans. So this is his MRI scan. This is the back of the shoulder. This is the front of the shoulder. You can see the rotator cuff at the front of the shoulder, rotator cuff around the back. This is deltoid. You can see skin there, little biceps tendon there, the long-headed biceps sitting in the groove. This is the socket. You can see the black is the bone. Then you've got a grey layer of cartilage. Got two grey layers of cartilage. There's fluid in there. The white is fluid. He's had a recent injury, so that's mostly hematoma in there. And that's the labrum at the back of the shoulder, that triangle there. That's fibre cartilage, turns out black on the MRI scan. And that should be mirrored to the front of the shoulder, and it's not. This is the labrum out here, and there's a tear through here. And he has dislocated shoulder out the front of the shoulder, so the ball of the shoulder has come out the front, sat over here, and it's gone through here with the labrum going that way and coming in through here. We can see in the back of the shoulder, there's a dent in the back of the shoulder. You can see that dent there. Well, that's from the shoulder coming out the front of the shoulder and hitting back against that corner there and giving a dent and an impression. That's called a Hill-Sachs fracture or Hill-Sachs lesion. The white there is actually bone bruising. It's actually high fluid content in the bone during the bruising related to that injury. And it shows that this is an MRI scan taken soon after the injury. If we look at the CT scan, what we see here is loss of bone from the front of the shoulder. This should be pear-shaped, and it's not really. The bottom part of this should be wider than the top part, and it's not really. The bottom is about the same width as the top part. So there's been significant bone loss from the front of the shoulder here. This is the 3D CT scan, the reconstruction you can see there. It's pretty cool. That's of the shoulder blade. The humerus has been subtracted or taken off. And you can see where the previous stabilisation has been performed. You can see these are anchor points from the previous anchors have been put in for the labral repair. And what we're talking about with this patient is doing an arthroscopic Latarjet and labral repair because there's a failed previous soft tissue stabilisation and there's bone loss there. He's a professional contact athlete, and that's the most appropriate operation for him in this situation. Thank you for listening.